there, my name is Tia and I'm part of the Health and Wellbeing coaching team for Xyla Health and Wellbeing, who are the providers of the Healthier You NHS Diabetes Prevention Programme. Our programme is completely free and helps to support those that are at risk of developing type 2 diabetes to make small but really meaningful changes to their lifestyle to help reduce their risk of developing type 2 diabetes in the future. Some of the key symptoms we might experience are excessive thirst, frequent urination, weakness, drowsiness, and even blurred vision. But what's really interesting is that everyone will experience these symptoms at different stages. Some people might experience them quite early on when they're at risk of developing type 2 diabetes, whereas others who have type 2 diabetes might take years to develop these symptoms. But also some people may never experience them, and that's why many people could be living with the condition, but they simply don't know about it. But these symptoms are something that we could look out for, as they may be a sign that we are at risk of developing type 2 diabetes. So if you are experiencing any of these symptoms, please do visit your GP. There are also several risk factors that can increase our chances of developing type 2 diabetes. Some of these factors are sadly out of our control. So there's not a lot that we can do about our family history, but our family history does play a role. If we have a close relative who has type 2 diabetes, this can increase our risk. Age can also play a role. Those who are over 40 years of age are more at risk if they're from a white European background. But those who are South Asian, African Caribbean, or Black African are more at risk from as young as 25 years of age. Ethnicity. Type 2 diabetes is up to 6 times more likely to develop in people from a South Asian, African Caribbean, or Black African background compared to those from a white European background. So these factors are out of our control. There's nothing that we can do about these risk factors. But there are also some factors that are within our control, and so these are the factors that we want to look towards making small but really meaningful changes to help reduce our risk of developing type 2 diabetes. Weight. Individuals who are living with obesity or are overweight are more likely to develop diabetes than people of a healthy weight. So could we try to manage a healthy weight? So if we are within the overweight or obese BMI category, losing a modest amount of 5% of our body weight can have a really meaningful benefit in reducing our risk. Elevated waist circumference can also increase our risk. Diet, what we eat and how much we eat can also have an impact. So could we look to manage the foods we eat and also our portion sizes? Inactivity, the more inactive we are at work and at home, and being seated for lengthy periods can also increase our risk. So could we try to be more active and reduce our sitting time? There are also other factors such as stress and sleep, so could we look towards managing our stress and improving our sleep to help reduce our risk? So it's really important that we focus on what we can control, focusing on making small but really meaningful changes to the risk factors that we can control can really help improve our health and reduce our risk of developing diabetes. And you might wonder what factors have the most impact on our health. So I've got some factors here: medical care, behaviour, genetics, and other factors such as family, social and education. And all of these factors contribute to our health. But our behaviour is what has the most impact on our health, with a 40% contribution to our overall health. Often people can overestimate the effects of medical care and genetics, but what this shows us is that what we can do with our behaviours is the most important aspect in looking after our health. So focusing on what we can control will have the most benefit to our health. So how does our behaviour reduce our risk? When we are at risk of type 2 diabetes, we have what we call pre-diabetes. Pre-diabetes is when our blood glucose, often known as our blood sugar, is higher than normal. It's not yet high enough to be considered type 2 diabetes, but without lifestyle changes adults and children with prediabetes are more likely to go on to develop type 2 diabetes. So prediabetes isn't a condition in itself, it's a range of risk which acts as a warning to us that our bodies are beginning to struggle to manage our blood glucose levels. And the Diabetes Prevention Programme helps to support those with prediabetes to make those small but really meaningful changes to their lifestyle to help bring those blood glucose levels down into a healthy range, or at the very least, prevent them from elevating into the type 2 diabetes range. If you're experiencing any of the signs and symptoms of type 2 diabetes, please visit your GP. If they choose to take a blood test which results in a diagnosis of pre-diabetes, with your approval, your GP can refer you onto the programme. Or if you've had a blood test from a healthcare professional within the last 24 months which resulted in a diagnosis of pre-diabetes, using your blood test result, the date of the blood test and your NHS number, you can self-refer on our website. But also, until the end of September, there is a fantastic online pathway available into the programme called the Know Your Risk tool. This is a short questionnaire that assesses your risk of developing type 2 diabetes. If you score moderate to high risk, which is a score of 16 or above, you'll be invited to sign up to the programme, and you just need to complete a short form to sign up once you've completed the questionnaire. And you can find this questionnaire on our website. So this online questionnaire is a really nice and accessible tool which only takes a couple of minutes to complete. If you complete the questionnaire in the coming days and it shows that you aren't at risk, that is absolutely fantastic. But in years to come, if you do experience any of the signs or symptoms that we spoke about earlier today, such as excessive thirst, increased urination, fatigue, drowsiness, or even blurred vision, then please do visit your GP for advice, as you may be eligible for the programme in the future. But if you are eligible for the programme, once we receive your referral, our patient support team will give you a call to book you onto the programme. First of all, you'll be invited to take part in our initial assessment over the phone. This will include an introduction to the programme so that you know what to expect during the programme, and it also provides us with the opportunity to identify your long-term goals so that we can break this down and begin to set you some short-term and long-term goals. Once the initial assessment is complete, you will then be invited to take part in our group sessions, which are usually delivered face-to-face, but they are currently being delivered remotely. So at the moment, you will have the choice to take part in remote sessions delivered either through Microsoft Teams or Fuse, which is a telephone dial-in service. In total, there are 13 group sessions which take place over 9 months. 9 months can sound like a really scary commitment, but there are only 13 hour-long sessions, and the reason that we deliver them over 9 months is so that there is plenty of time between sessions to allow you time to digest the information and begin to implement some small but regular changes to your lifestyle so that it's manageable and achievable. And we will discuss the content of these sessions in a little bit more detail in a moment. But once you've completed the group sessions, you will then be invited to take part in our end of programme review, which is one-to-one and held over the phone. This is where we can evaluate your progress, offer signposting to other services if you feel you need some support in other areas of your health, such as local physical activity programmes, but also we can review your next steps for continued healthy living. Although our group sessions do have a wide variety of availability, including evenings and weekends, if you do need a more flexible programme, we can refer you over to our digital service, which is delivered by a company called Aviva. Aviva has a more one-to-one approach where you'll have access to a personal coach on a one-to-one basis, and you will complete your programme through modules and quizzes on their app. But in order to be referred to the digital service, you must have access to a smartphone or a laptop with up-to-date technology. But if you choose to take part in our group sessions, this is a fantastic opportunity where the group can share their experiences and challenges. Everyone on the programme is there for very similar reasons, so the group sessions are a really nice support network where you can learn from each other and really support each other as well. So what do our group sessions include? There are 3 different elements to the programme. eating well, moving more and taking charge. The eating well element of the programme is where we explore our nutrition. So we look at improving our relationship with food. For example, rather than looking at different foods as good and bad or foods that we can and can't eat, we focus more on foods that we want to eat often and in our regular diet, and the foods that we want to try to eat just occasionally. We also explore understanding portion control and energy balance to ensure that we have a nice variety of foods. So we look at how we can make small changes to our food habits to help reduce our risk of developing type 2 diabetes. We also have a moving more element to the programme, which is where we explore physical activity, exercise and sedentary behaviour. There are a few simple messages we try to put across. Moving more is not just about going to the gym or running. It could be as very simple as minimising our sedentary behaviour. So we'll look at what sedentary behaviour is and how we can reduce it. We can minimise sedentary behaviour by increasing our daily physical activity. So for example, could we get off the bus one stop early so that we reduce the time we spend sitting and instead increase our walking time? We can also minimise our sedentary behaviour by doing formal exercise, such as swimming, cycling and many more. There are lots of different types of exercise, and so it's really important that you explore exercises that you enjoy if this is something that you would like to work on to reduce your risk of developing diabetes. And then we look at how being more active can help support our health and weight management goals. Another element to the programme is called Taking Charge, which is where we explore strategies to overcome obstacles that you might be facing. If it was as simple as knowing what we shouldn't be doing, we would all be doing it. But it's not as simple as that. There are everyday challenges that we might face along the way, so we explore how we can overcome these challenges for continued healthy living. We also look at creating healthy habits and tips for managing our stress and improving our sleep, because all of these factors can help support our journey in reducing our risk of developing type 2 diabetes. Throughout the programme, we take the opportunity to listen to our service users. So we have some examples of previous service users' experiences whilst on the Healthy NHS Diabetes Prevention Programme. One service user mentioned, whilst finding out I was at risk of type 2 diabetes by my GP, I enrolled onto the Healthy NHS Diabetes Prevention Programme. Since joining the programme, I've lost over 40 kilograms. Another mentioned, I'm really pleased that I did the programme and have invested in myself. I've had the opportunity to make better long-term choices. It is accessible to everyone and of course free. It has helped to make me really think about what I am doing. You should 100% do the programme. The material and delivery is not something that you can read in a book. We are Xyla Health and Wellbeing, and that was a little insight into the work we do at Healthy Diabetes Prevention Programme. Thank you.